Okay, this is my disclosure. Remember that all the pictures here are AI generated, so we don't say where they are from, but how I created them. So this is the prompts that I used. Alex, I think the machine has something to tell to you.
Dottor Alex, ascoltiamo l'opinione della macchina. Welcome to Athens Shoulder Course. Actually, I am not Dr. Bruno. I am not even real. I am an artificial intelligence avatar created based on Dr. Bruno's voice and video. I can say anything you want. Μπορώ επίσης να μιλήσω σε οποιαδήποτε γλώσσα, όπως και τα ελληνικά. Καλωσορίσατε στη νέα εποχή τεχνολογίας στη χειρουργική ώμου. Είμαι σίγουρος ότι ο γιατρός Μπρούνο είναι πολύ χαρούμενος που είναι εδώ.
Okay, anything's possible. Even Yannis Antetokounmpo playing for Brazil.
Hi, I am a robot surgeon and inviting you for Athens Shoulder Course in 2024. Can you find out which shoulder surgery master I was based on?
Okay, AI is changing everything. Some people say that AI will be more important for humankind than electricity and fire. You know, that's powerful. So what can we do with AI? We can automate process, we can give answers to patients, to surgeons, we can give surgical education, postoperative care, research review, and collaborative decision-making, Ruth just showed us. Most of everything I'm going to show here is in this link, so you can try yourself. So first, let's ask AI to explain the insurance, why a patient needs an arthroplasty, and I asked the AI to add some reference, and please be polite. We generally are not very polite with the insurance. So here are the AI answering what the patient needs, a reverse total shoulder arthroplasty. Let's ask an AI to give a summary of Dr. Bassan's video from last year's Athens Shoulder Course. So I just asked him to do the summary of that presentation. And this is the summary of Dr. Bassan's. Dr. Levy, I asked for key points for your last videos about short stem, and this is what the AI answered to me. This is a summary, so I don't need to look at your video from last presentation. Can we generate in specific cases? These all X-rays are AI generated. This person does not exist. None of these persons does exist. These are all AI generated. Pretty impressive, yes? Yes. We are trying with shoulder. These are my attempts to create shoulders with AI. As you can see, we are not there yet, but I'm pretty sure maybe in next year or maybe in Vancouver, we can show a better AI X-ray created, X-ray of a shoulder created by AI. Can we create personalized cases? Yes, we can create a specific pathology and create scenario. We don't have legal problems, do an authorized image. For example, in the future, we will ask AI to create a AP or lateral view of a patient with 120 elevation, whatever you want, and the AI will understand that, well, this might be the X-ray of that patient, and this lady does not exist too. We can create 3D models. We are not there yet, so these are not 3D models created by AI, but we're also looking on that. So let's test how our implant will be with a B2 glenoid. Okay, now let's test with a C glenoid. We can do that with AI. Can we create a presentation in less than a minute? Yes, this is what we have to write to the AI. Just copy what is there. The AI is creating. Paste to PowerPoint. That's it. I just now going to use the AI from PowerPoint to choose the best pictures for me. And it's here. Okay, let's go. Can AI ask questions? Yes, this is an AI that I trained based on George's lectures on Thursday. And I just ask a question. You can try yourself. This is and she answers in Greek. Is this correct, Manos? I'm not sure, but this is what AI written. I'm developing a project called Project Copilot to help surgeons during surgery with AI. Let's see. You can test. With the humeral cut. Okay, now I need help with the retractors
on the glenoid. Great. Can you show me a video for the coracoid tracker? I need help. Can you show me Joseph Zuckerman video? I did not like this approach. Please show me Howard's. Thank you. What is the next step after the coracoid guide placement?
So, George, this would be the hybrid of mixed reality and AI we are talking about.
Open Equinox planning app, then go to lateral view, superior view, and front view. For last, go to the CT view.
So we can ask the AI to, during the surgery, to perform some things in our computer, just like that, as I show.
Open.
Sorry. Or AI for assistant, post-op.
My name is Franciele, and I had a shoulder arthroplasty surgery.
You can try yourself in this link.
It's great to meet you. I'm here to assist you with any questions or concerns you might have after your shoulder arthroplasty surgery. How are you feeling today? And is there anything specific you would like to know or discuss about your postoperative care?
When should I remove my dressings?
Franciele, you should remove your surgical dressings 3 days after your surgery. However, remember to leave the steri strips over the surgical sites intact. If any of them come off accidentally, just apply a sterile Band-Aid to the area. If you have any other questions or need more information, feel free to ask.
George, you asked me about sex, and I tried. And the first, when can I have sex after my arthroplasty surgery? He goes, but then I give me an estimation based on your knowledge. And she could answer, or she could estimate or tell you that it's about 4 to 6 weeks. This, well, of course, depending on the sex, for sure. Well, we have developed an AI tool called Predictive with the team with Equinox, which is the Predictive. It's a tool that we provide 19 inputs from the patient, and these are the inputs. And we can predict how will be the patient after a reverse or a total shoulder arthroplasty in the future, based on their problems, based on their pain, based on their range of motion. So these are the predicts AI can do based on lots of data from the Exatech database. So we can do personalized predictions. We can identify complication risk for specific that patient, and we can use a decision making based on data predictions. Imagine that you have a history, a medical history, big. This is it's a short one, okay? And you want to know something about the patient. Just ask the AI. Not how I was after my rotator cuff surgery. So she's reading the medical record, and he'll answer. No pain. The pain was 3 out of 10. Function. Let's go. Did the patient had any injections? According to the information, injections in 2019. And now it's mind-blowing. I asked the evolution. I never said, in the medical record, it's never said that the patient was worse. The medical records say the pain was 3, and then in the future, the pain was 7. And the AI could understand that the patient got worse in pain, and the range of motion was also limited. These words were never written on the medical record. Can we do AI for scientific articles? Yes, we can. This is an AI that I created for Jesus International, but they blocked me, so it's not working, sorry. But yes, we can just ask an action. We can ask to summarize a study, and create a video. That's it.
The study aimed to compare the long-term patient-reported outcomes of reverse shoulder arthroplasty, RSA, and hemiarthroplasty, HA, for cuff tear arthropathy.
Let's go. Or can we do AI our statistics job? Yes, let's go. This was done on Thursday. So I just feed this Excel file, and I just ask for the insights, age statistics, BMI statistics. The data, okay, this is the answer. The data set, the ranges from 0 to 43, and she understands that normally. The mean age is 183. She knows that's not correct, so she herself excluded the outliers and herself decided that the median age was 72. The same for body BMI, and I asked for gender distribution, and that's it. I asked it to do a comparison if the patient with previous surgery had lower or better active abduction, and he can do it very quickly. We can do a logistics regression. I asked a logistics regression to BMI as an impact of active abduction, and this is the answer that the AI just answered us. I have to be quick. I asked a graph of sex distribution, and just my nurse, she does not do what I ask, she does what needs to be done. She did a gender distribution. Now I ask her to make a pizza graph. Well, she did a pie chart, so she's pretty smart. Very quick.
Η γκόμενα ήταν καταπληκτική χθες. Me and real Bruno are very happy to be here. Ευχαριστώ.
And for take-home message, you have learned that you have to have some 3D modeling skills for planning, but sorry, in the future, you always have to have some prompt engineering skills to deal with AI. Sorry about that. Thank you very much.